Did you know that there are trillions of microorganisms on our body? In fact, the United States Department of Health and Human Services have revealed that there are 10 microorganisms to one human cell. These microorganisms are everywhere. They are on our skin, in our guts, and including in our nose. That makes my nose itchy. We have heard about vaccination in one way or the other, either from doctors when we go for our doctor's visits, during school registration, including getting vaccinated ourselves. We will go ahead and talk about what these vaccines are, what vaccination is, the types of vaccines. Vaccines are modified microorganisms or even products of microorganisms. The act of giving a vaccine is known as vaccination. It is given to defend the body against these microorganisms and the diseases that they cause. There are different types of vaccines and how to administer vaccines. There is the inactivated vaccines, the live attenuated vaccines. There is the messenger RNA vaccine, the toxoid vaccine, and so on. I'm sure this sounds like a foreign language to a non-medical audience, but essentially what this means is that in production of these vaccines, the chemists take into consideration the targeted audience, the targeted population, be it a child or an adult. They also take into consideration the type of microorganism, its characteristics, and how the body is going to react to the microorganism. The methods of vaccination include that vaccination can be administered orally. It can be given through the skin, subcutaneously. It can be given intramuscularly into our muscles, and it can also be given intranasally. Now that we have discussed about vaccines and vaccination and the types of vaccination, we're going to delve into how vaccines work. So when a person gets vaccinated, these vaccines elicit the production of antibodies. These are defense mechanisms or soldiers of the body that fight against diseases. These antibodies, they fight the vaccines and they mount a surveillance around the body so that when the individual eventually gets exposed to that microorganism, that person already has the defense against the diseases that that microorganism may produce. So vaccination mimics the way our body would already fight a microorganism, but after vaccination, the delay that it takes to mobilize these antibodies is cut off so that the soldiers are already there to fight these microorganisms, preventing any form of disease. There is also what is called a herd immunity. This is a situation where when some members of the community are unable to receive vaccines, maybe due to one medical condition or the other, such as being immunocompromised, they are safe because most members of that community have received the vaccine and are immune to that disease, so that the disease is not transferred from one person to the other. Now that we have talked about how vaccines work, let us look at how vaccination is given in the United States. The CDC recommends the vaccination schedule used in the United States. It is determined depending on the doses and the age of the patient. It has a schedule for both the child, adolescents, adults in the community. The healthcare providers use this vaccination schedule as a guide in administering vaccination to their patients. This is an example of a CDC vaccination schedule recommended for the United States. In conclusion, we have learned what vaccination is, how it works, and the vaccination schedule used in the United States. It is awesome how the body is able to remember the defense mechanism to be used against this trillion number of microorganisms. Now my nose does not itch as much.